Good morning. Welcome. Welcome in, everyone. Thank you for being here today. We're going to get started here shortly, just waiting on everyone to get in. We're really glad you're here. So while we settle in, I'm just going to go over some quick housekeeping items. I'm going to be your host today. My name is Jennifer Martinez. I'm a doctoral student at Portland State University. My pronouns are she, her, ella. And I just really want to welcome you today to listen to our statewide Oregon COVID-19 farm worker study preliminary findings here at this press conference. And just a little about me, I served as the organizer / facilitator for this extremely collaborative project with our own researchers here in Oregon and over 11 on-the-ground community-based partners and policy advocates. So we're really excited for you to receive this brief of our preliminary findings from this first phase of our study. So as you welcome in and get settled in, I do just want to go over some brief points. Just really quickly, our team will be speaking in both English and Spanish. If you need interpretation, please click on the button at the bottom of your screen and select a channel. You could select either English or Spanish. If you do not select a channel, you'll hear us speak in both English and Spanish. Brevemente en español, bienvenidos, gracias por estar aquí. Estamos contentos que se unan a escuchar estos resultados. Nuestro equipo hablará en español y inglés. Si necesita interpretación, haga clic en el botón hacia abajo de su pantalla y seleccione un canal. Puede seleccionar inglés o en español. Si no selecciona un canal, no se escuchará tanto en inglés como en español. Our interpreter today will be Reina Castellanos with the Linguistica team. So hi, Reina. Thank you for supporting us today. If you're joining over the phone, she also has a conference line you can dial, and that conference line number will be posted in the chat by our group. We have a great team of facilitators working in the background to make sure you have an enjoyable experience. So they'll be posting that conference number for us. Right now, you're all muted, but we welcome your comments and questions. You can submit those questions throughout our time together here by clicking on the Q&A button at the bottom of your screen. We'll also have a Q&A segment after the presentations. Also want to encourage you to make this an interactive space, so feel free to use the chat feature to share information with attendees or panelists. You could also, once again, send a message to our technical team behind the scenes if you have some sort of problem. Given that this is a press conference, we're going to prioritize questions from the media today, but those not with the press, we did see we have a lot of folks in government agencies joining us today. We're happy to connect with you and answer any questions you have. So please get in touch with us. You should have all received a press kit with our brief with preliminary findings and more information on how to get in touch. So be sure to visit that if you have additional questions. Just really briefly on the flow of the conversation today, the majority of our time together will be spent hearing testimony from our community partners that carried out the survey. Then we're going to transition to a Q&A discussion featuring Reina Lopez from Pecun Farm Workers and Latinx Working Families United and Ubaldo Hernandez from Comunidades, and a slate of scholars available for questions, including Ron Mize from Oregon State University and Lynn Stevens from University of Oregon. So now I'm just going to briefly introduce the project. This is a tri-state effort extending into California and Washington. California has published their survey results as well, and Washington is on their way to getting results soon. So overall, this effort was ignited as a response to an overwhelming proportion of the Latinx and Indigenous people working in agriculture experiencing disproportionate higher rates of COVID-19 infection than folks from other ethnic backgrounds and industries. And we know with the wildfires experienced here in Oregon, our concerning preliminary findings will only become more bleak. So currently, Oregon Health Authority's COVID-19 weekly report continues to highlight food packing and agricultural work sites as uniquely vulnerable to the spread of the virus. But we don't have a clear picture of how COVID has spread across Oregon's 174,000 farm workers and their families. So the current reporting system discloses workplaces that have incidents of 5 or more, or employ at least 30 folks in those work sites. So we hope that this brief does connect the dots and gives us an informed response. So now I'm going to transition over to give you just high-level details about our survey structure, and then hand over the mic. So the preliminary results you're going to hear today are based on 214 surveys from our total sample of 300 telephone surveys. And farm workers were surveyed all across the state, and the results you'll hear today are from 12 different counties. The survey design methodology is a convenient sample. It is not a random sample of the entire agricultural workers in Oregon. However, by allocating interviews among geographic regions according to the shares of estimated labor demand for around this time, the Oregon sample is a good faith effort to include agricultural workers in proportion to where they are employed. And the rapid nature of the study was only possible by using a snowball sample technique with trusted networks that serve farm worker communities. So in this partial data set, 58% of farm workers identified as women and 42 as men. The median age was 40. 72% of farm workers told us they were married or in a partnership, and most of our sample had children aged 12 or younger. 39% of farm workers reported working for a farm labor contractor or a personnel agency. 46% reported being directly employed by a grower, and 9% reported working for a packing house, and 3% preferred not to answer. The vast majority of farm workers have lived in the United States over 15 years, and 33 reported living here less than 14 years. So this is mostly a settled community. And approximately 81% of respondents were born in Mexico, and 12% were born in Guatemala. And 24% of the farm workers that identified as indigenous, 24% of our farm workers that were surveyed identified as indigenous to Mexico or Guatemala, and nearly 3% of our respondents identified as Two-Spirit or LGBTQI. So now I'm going to switch over to our testimonials and hand over the mic. So here in Oregon, the Alameda fires alone destroyed over 2,000 homes, including 14 mobile home parks, many of those where farm workers live. So with that, we will kick off our testimonies with Kathy Kisi Morales with UNETE, Center for Farm Worker Advocacy. She surveyed farm workers primarily in Southern Oregon, and she will tell us how the wildfires are intensifying COVID-19 impacts. So over to you, Kathy.
Hi, Jennifer. Thank you. And thank you for inviting us to be part of the interviewing process. I think it's really important for our state to have this information. So my name is Kathy Kazee, and I'm from UNETE. I just wanted to mention, I was asked to mention the call-in phone number is 978-990-5000, and the password is 118026#. So UNETE has been providing services to families in quarantine here in Jackson County due to COVID, and we've reached out since August to about 180 different people. However, the total positive COVID cases in the Latino community here are around 48%, although they really only represent 30% of the population. And unfortunately, many of these families that were impacted have people that are agricultural workers. So throughout part of that outreach, we found people that were working in the hemp here, where, especially in one case where there's a foreman who told the workers that if they indeed did have symptoms of COVID, that they were not to report their symptoms to anyone, and they were just supposed to stay home until they felt better. And unfortunately, they were also threatened that if they did report, that he wouldn't pay them or that he would fire them from their job. And since people just started working, they couldn't afford, honestly, to respond to the calls from public health. So in that time, unfortunately, we did see a big jump in COVID cases here in the Valley. So on September 8th, as you probably know, we had wildfires that tore through the south end of our valley and destroyed about 2,500 homes, mostly in the Phoenix Talent School District, where they estimate that over 60% of their students lost homes. And again, many of those families had egg workers living in that affordable housing. So these fires have forced people into these congregate living situations, and we've heard as many as 19 families in one home, 19 people, that would be congregate, wouldn't it? 19 people in one home, and as many as 11 in hotel rooms. And so obviously they're unable to practice social distancing there, and so we really fear that they're going to be increasing their exposure again to COVID. So about on September 10th, the winds in the valley died down, and so then the smoke filled. And this in our valley, there's a real issue with inversion, so the smoke doesn't lift for days. And so at some points, the air quality here was the worst rating in the world, apparently, about 492, the air quality rating considered hazardous. And so there were workers who were still out on the camp, were still working. Some had lost power and water, so they were forced to return back to their homes from evacuation centers. And others were forced to, because of the lack of power or water, they had to bathe like in streams that were close to their camps where they passed through fields of livestock. And so we can pretty much only imagine the types of bacteria and pesticides and things that they were exposed to. And so I was at the evacuation center many of those days, and I was talking with some workers who were eating dinner. They would move to the evacuation center because their homes had burned during the fires. And one I noticed had a mask that was not rated for smoke. And luckily I had some, so I gave them to him. And I just want to add that here in the Valley, there was a team that worked together to let all the growers know through the employment department that there was free PPE rated for smoke available for them to pick up. And as all they needed to do was pick it up. But here, this worker again, it was clear that he'd been wearing the mask for a while. It looked like it was damp, it was dirty. And I knew that at that point, basically those types of masks are rendered pretty much ineffective. So luckily, last week, the smoke cleared out of the valley, but again, the air quality remains still at hazardous, or not hazardous, but unhealthy levels. So just a reminder, these workers are transported in school buses with open windows because they don't have air conditioning inside, so they're exposed to the smoke to and from their work. They also work in the smoke all day long in masks that apparently are not rated for smoke. And as I mentioned, they get sweaty and dirty, so basically they're pretty useless. And then when they return home, they don't have air conditioning in their labor camps, or some don't even have fans, so they leave the windows and the doors open. And again, the smoke penetrates into their rooms, and while they're sleeping and eating. And even in some of the camps, even the cooking facilities are located outdoors, so they don't have any relief from the smoke. So essentially, the local farm workers down here in the pear harvest could not get a break from the smoke. And so not only that, but living in these tighter quarters, we're really concerned about the risk of COVID that they may have been exposed to, and we're really hoping that we don't see a big spike in COVID cases here in the next few weeks. So again, thank you, Jennifer, for inviting us to be part of this interview process, and we really look forward to collaborating on positive changes for farm workers in the future.
Thank you so much, Kathy, for your testimony on how the wildfires are adding an additional layer of crisis and insecurity for farm workers. Next, we're going to talk a little bit about the economic challenges farm workers experience throughout this COVID-19 pandemic. Many of them told us that they've experienced significant loss of work and income during COVID-19 pandemic, creating broad challenges across their lives. And so in our study, 37% of farm workers reported losing months of work, and 39% reported losing weeks of wages. So Sandra Martin from Bienestar will tell us about the economic impacts farm workers are experiencing currently. She had a last-minute family emergency, so she actually will not be able to be with us today. However, she did leave us with a pre-recorded testimony, so I'm going to play it here for all of us. If Beth, can you make me host so I could share my screen? Or here we go. Thank you so much. And hopefully everyone can hear it and see my video.
Buenos días, mi nombre es Sandra Martín. Yo represento a la organización de Bienestar. Con todas las entrevistas que estuvimos viendo, nos tuvimos muchos impactos, ¿verdad? Y uno de los encuentros es como muchas personas se quedaron sin trabajo por medio de esta pandemia. Unas personas fueron por meses, otras por semanas y otras por días, ¿verdad? Esto, pues, vino a desestabilizar económicamente a muchas familias. Vimos que personas que trabajaban en restaurantes que fueron también más afectados, pues se vieron la necesidad de buscar trabajo en el campo, donde pues no iban, salían por días y así van viendo y cómo salir adelante, pues, como testimonio que puedo dar de que nosotros como familia aprendimos bastante aplicados,
I'm hearing,
trabajo de equipos.
I'm hearing from folks that it's hard to hear the video. So because of that, I'm going to go ahead and just post Sandra's testimony to our website so that everyone can hear it afterwards. And we're so sorry about this technical difficulty, but I'll move forward for now, and we'll send you all after this webinar her testimony as well so that you have a chance to hear it. So with that, I will stop sharing my screen, and then I'm going to hand it over now the mic to Antonio Garcia and really talk about aside from economic challenges, we're really going to move to work site, how farm workers are living once they're at their jobs and their work site. And so when PPE and masks are available, farm workers take necessary precautions and safety procedures at home and in the workplace to minimize exposure to COVID-19, whether that's changing their mean of travel to and from work, washing their hands more often, or changing their routine when they get home. These are all reports that what farm workers told us, right? That they were changing their practices. But still, 39% of farm workers reported moments during the day where they could not maintain 6 feet distance in the workplace. And that was either due to the nature of the work or during meetings. And about 31% of farm workers told us employers required them to be closer than 6 feet without protection or PPE. So now I'm gonna give the mic to Antonio Garcia from Centro Cultural de Washington County, and he will give us testimony on what farm workers are experiencing on the job. So over to you, Antonio.
All right, so as stated before, I'm Antonio Garcia from representing Centro Cultural and Centro Prosperidad in specific here in the Washington County. And as stated, most of my surveys were from people that were local to the Washington County area, so that's where they were having most of their workload or where they were living. So in a specific case, a lady told me that some of the conditions were only changing in her workplace when it was actually inspections are becoming more mandatory nowadays, and only when they would come around to check the conditions of bathrooms, of lunch rooms and places like that, where it's necessary to have like washing stations and places where you need to be sometimes even closer to other people. So these were really disgusting, is what she said, but in Spanish, obviously, because it was native. And they weren't kept to the regulations until they were actually forced. Someone came and checked them, but then by then they would just clean them the same day. So it was by no means protecting our actual community and our farm workers. And in another case here in the Washington County is laborers find it difficult to actually maintain 6 feet. And this is because when they're picking blueberries in specific, or any type of berry here that's native to Oregon, they usually have to load them onto a truck or to some sort of machine to start sorting them out. And during this time, they have to get closer to other workers who are trying to keep efficiency up, and they're trying to, please basically the rancher and earn positive feedback. So most of them some of them actually broke the 6 feet rule. And then in another case, farm workers actually, a specific other lady told me that when they were going down the rows picking berries, obviously some of them wanted to be more efficient, so they would just get closer to 6 feet and they wouldn't follow regulations. And that's not to say that that's their fault, but possibly a mishap in communication. So obviously these were being broken. And but on a better note, 58%, 57% actually do report that they wash their hands more than 5 times. So we at least know that they are getting some type of water, even though water has been reported through the Washington County surveys too, that it's scarce in some workplaces, which is actually kind of frightening. So we also still need to provide advocacy and work on that. And then on another bright note, 77% of all workers actually from this survey, we realized that they actually do wear masks. So that's still not necessarily 100% that we want. So there's still not enough advocacy on that behalf. So that's the main findings that I found in Washington County, thanks to this survey. So back to Jennifer.
Thank you, Antonio, so much for that thorough, testimonial of how things are in the workplace. Now we're going to switch over to talking about indigeneity within our sample. About 23% of farm workers reported being indigenous, Mesoamerican to Mexico or Guatemala. And farm workers speak indigenous languages face additional information and accessibility gaps. And including in our study, we found that included knowledge about existing relief funds or sick and family leave benefits. So next, I'm going to pass the mic over to Valentin Sanchez at the Oregon Law Center, who interviewed many farm workers that identified as indigenous, and he will be telling us about the information accessibility gaps farm workers are experiencing and working through in this pandemic. So over to you, Valentin.
Thank you so much, Jennifer. My name is Valentin Sanchez, and I'll be speaking briefly about the gaps in services and protective measures important to some of the most vulnerable communities in Oregon, farm workers, and in particular, farm workers who speak an indigenous language. I have been a community educator with the Oregon Law Center's Farm Worker Program for 17 years. The Oregon Law Center is a nonprofit organization that provides free legal help to low-income Oregonians to achieve justice by providing a full range of the highest quality civil legal services. We have 10 offices in largely rural counties around the state to better serve our low-income communities. Oregon is home to 22 different indigenous languages from Mexico and Guatemala spoken by farm workers. It is important to note that these indigenous languages don't have a resemblance to Spanish. Interpretation. While some indigenous may speak rudimentary Spanish, many prefer to communicate in their native language. I am a former farm worker who has firsthand experience about the challenges farm workers face, in particular indigenous farm workers. Over the last 17 years, I have been working on issues that impacts our farm worker community. For nearly 20 years, the Oregon Law Center, through its Indigenous Project, have presented to agencies and others about the presence and needs of indigenous farm workers. As part of this work, I have conducted extensive and targeted outreach in our state, visiting labor housing and low-income housing, providing radio interviews and community presentations, attending resource fairs, and visiting other venues to provide information and resources in our farm worker communities. My ability to speak Mixteco, an indigenous language from Mexico, has opened many doors into the lives of indigenous farm workers in our state. One key finding in this research study indicates the farm workers who identified as indigenous reported language issues and almost a complete lack of information in their native language available. This finding is not surprising to me based on my experience over the last 17 years. Without language appropriate materials and services, indigenous language speakers are not able to access assistance, protection, or receive information on prevention, not just because of the language barrier, but because of our inadequate system. Language accessible services are particularly important when we rely on a group of to perform labor, no matter the hazardous condition. Another key finding shows that 1/2 or more farm workers surveyed remain unaware of sick leave benefits and existing relief funds organized by the federal government and our state. These benefits exist to protect the public health of our essential workers in our state, and yet they cannot achieve their purpose if people do not know about them. This is a significant finding, given that our public health experts recommend people who have been in contact with a person who has tested positive COVID-19 to self-isolate or quarantine for 2 weeks. This finding further speaks to the need for agencies to better understand the communities they serve. When workers live paycheck to paycheck, information about these benefits and resources is critically important to reduce and prevent the spread of COVID-19 in our state. Thank you.
Thank you so much, Valentin, for that important testimony. And I think as you mentioned, it's ubiquitous to think about how language only exacerbates the resources during this time. Now, really important to discuss COVID-19 infection. COVID-19 is live and well within our farm worker communities. Overall, only 37% of our farm workers reported getting tested for COVID-19, and 34% of farm workers reported they knew coworkers infected already, and another 20% reported someone in their household has been infected. But cost and fear of losing a job is a significant barrier to accessing care. So now we're going to hear from Anabel Hernandez Mejia. She's from Farm Worker Housing Development Corporation, and she'll tell us about COVID-19 testing, access to care, and the ability to isolate. So over to you, Anabel.
Hi everyone, yes, my name is Anabel Hernandez Mejia. I am Resident Leadership Coordinator with Farm Worker Housing Development Corporation. And with that, one of the things that we had done, and this is just as an example, FHDC has brought on COVID testing on site, so practically almost to the doors of the residents. And even then, when we did do that, we didn't get very much over 50%. Maximum was about 56% of our residents that got tested. With this survey, we were actually able to sort of get that background information and additional information as far as what were those impediments to not reaching closer to that 100% rate. And really what came up aside from disinformation was a lot of fear and concern from the farm workers themselves. So what happened, and of course within them, once there's a bad experience, the word spreads, right? And they share, and that is one of the ways that they gain information is from peers and coworkers. So when people got tested, and even though they were testing for trying to be responsible, even though they didn't have symptoms, it was available, and just to be sure, they still were going back to work and being met by their patrones, sending them home, because the only thought of being tested was because you somehow had a risk or you had to be positive in some way or someone close to you. So they automatically would send them home and they would have to get a second test done. And what would happen there was the second test was not available for free. They would have to pay, I believe, at least $120 for that test. And the clinics also would turn them away because if they did not have symptoms, they were not prioritizing them or giving them the test openly like that to everyone. So what happened was not only did they miss work and have to put in out-of-pocket money to pay for the exam, is that they were having difficulties also even being able to reach a test to show there was a second negative test and that they were not positive. So then that ended up stopping several residents from doing that. Another thing was, again, disinformation, as far as people thought that the swab being done was actually putting in the infection in them. Or another response that we heard plenty of was they felt good, and if they got the results, they didn't want to hear that they were positive. That basically translated into they didn't want to lose wages. They've already were going through trouble. Winter is usually the difficult months, and during harvest season, all this time they're able to save up for the following year. However, being stopped and already reduced hours, they did not want to run that risk of having to say that they were positive and then losing more amount of work. Then again, if they were positive, they were also losing those 2 weeks of income at least, and that played into the isolation difficulties. Most of our residents, as Jennifer had mentioned, they are living either in single home families or apartments, where the vast majority, and within those they were living in several families in what would be for a single family area or space. So it was very difficult to isolate when every bedroom in the house or an apartment, depending where they were living, was already occupied by a family or a member of the family. And even when in an apartment or a place where they were able to put other family members into other rooms, and at least try to use one bedroom for the person who had COVID, they were then having to share a single bathroom in that one unit. So if it were a 2-bedroom apartment, which was many cases, they had that same bathroom and they still had to share it. So those were some of the reasons why, especially when a person got sick in the family, everybody ended up catching it. And it was very difficult for families to be able, not only because they had that lack of space, again, the lack of knowledge, again, going back to what some of our peers have been saying, colleagues here, is that there was a lack of knowledge as to some of the funds and where to go or how to seek for some of these resources, as well as their rights for then again going back into work, and knowledge of their patrones, letting them know that if people were testing, it wasn't necessarily because they were at risk. It was more of they were trying to be proactive and participating, at least in this, because they knew of the there were people who could be asymptomatic and not show any symptoms, and wanting to be again proactive resulted in them losing work, losing income, and putting them further behind. And a lot of what again became what their bills, and that was mostly it.
Thank you so much, Annabelle, for that important testimony. And as you mentioned, all of these things are connected, right? I do want to remind everyone to submit your questions in the Q&A box or in the comment chat box if you'd like. We have one more testimony lined up, and then we'll briefly hear from our fiscal sponsors, and then get to the Q&A session. So please feel free to drop your questions in the comment box, in the chat box, or in the Q&A box. So now, something unique about our survey is that we did ask about mental health and how people are feeling during this time. And about 27% of farm workers told us that they were scared or depressed, and 19% said they were tired. While 79% of farm workers surveyed have children in their care, most farm workers that responded to our survey told us that aside from challenges they are, just connected to COVID-19, they were also concerned about children in their care. Many parents worry about their children missing school or having to go to school at home, and they were affected by this transition. So now I'm going to pass the mic over to Lynn Steven from the University of Oregon, who also did some surveys, and she will tell us about how farm workers are feeling right now and how they are balancing their children's needs as they transition to virtual education while simultaneously supporting relatives here in the US and those living back home. So over to you, Lynn.
Thank you so much, Jennifer. I'm Lynn Steven. I'm Philip H. Knight Chair and Distinguished Professor of Anthropology at the University of Oregon. And I've been working with immigrant communities, indigenous communities, and doing research in Guatemala, Mexico, and the US for at least the past 20 years. It's been great to be a part of this wonderful team and survey. I did surveys primarily of Hmong indigenous farm workers in Lane County, on the coast, and in Bend. Most of these conversations take about an hour. Some of them take about an hour and a half. So they're quite extensive conversations. And one of the things I think is really important to remember is we're talking about farm workers, but farm workers are whole people who have whole lives, who have children, who have parents, who have extended families. And they are, like all of us, connected, not just connected here in Oregon, but almost all maintain daily or weekly phone calls, connections, WhatsApps with their families in different parts of Mexico and Guatemala, small number in Honduras and Peru. So everything is connected. And the 3 points I want to talk about also emphasize that connection. Farm workers are also caregivers. As Jenny mentioned, 75% have children, 1 to 4 children. So managing that care work while also managing farm work has a lot of stresses. And one of the things that stood out for me in my conversations was how much people worry not only about work conditions, keeping their children safe, taking their clothes off, washing, decontaminating before they go into their house to even touch their kids, but they're also worrying about people who they support, One man I talked to is supporting 2 daughters and his wife in a small indigenous community in Guatemala. And he also has a daughter here. He lives in a room with his daughter in a house with other people. And he also has a disease, Parkinson's. And he goes out and works. He worked in blueberries, he's worked in grapes, he's picking salal, which is often found in floral arrangements. And he went out and worked in the smoke. And he was in touch with his wife and his daughters in Guatemala, where there's also no work. And this is cumulative stress. And that's one of the things I think that came through in my conversations was people, you know, they're depressed, they're tired, they're anxious, they're thinking about their folks back at home. What are the conditions there? We also asked about remittances, and that is sending money home. 40% of people who used to send money can't right now because they've been behind on their rent, or they had to borrow money and they're trying to pay that back. So they're bearing all of this on their shoulders. And sadly, 91% have no access to any kind of mental health services. But people are also amazing and resilient, and they talk to me about what they do when they feel depressed or anxious or fearful. People sing canciones románticas, romantic songs. They play with their kids. They exercise. They have a dia de campo or get out. So people are trying to cope with this, but still have a very big burden to bear. And they also worry about their relatives who have diabetes in Mexico and don't have access to healthcare or other kinds of things. And this all sort of comes together, not just in individual bodies, but in families. And these are essential workers putting food on our table. Interviews I did last week with 2 people, they were out there working in the smoke with air quality ratings, as Kathy said, up close to 500 because they couldn't stop working. And they also have homes, whether it's in Southern Oregon, whether it's in Lane County, whether it's in Woodburn, that don't have air purifiers. They don't have windows that seal shut. So the smoke, the fires, and all of this is being borne on the backs of people who are putting food on our table. And I'm just grateful for the opportunity that this survey has presented, the connections. And I'm grateful to all the work that all the advocates here in our community organizations are doing. And I look forward to working with everybody to support legislative change and further access to the rights and services that all of our farm worker folks and their families have rights to. Thanks so much.
Thank you, Lynn. I thank you for closing us out. I did see in the comments that there are some questions about having trouble, or some comments about having trouble hearing me. I'm gonna talk louder, and hopefully that'll do it. But Lynn, thank you so much. And I think you know, Lynn has touched on so many aspects, you know, that farm workers continue carrying right now, aspects that we usually tend to not acknowledge, or they stay invisible. So thank you, Lynn, for adding that to our testimony. Thank you again, everyone. I just want to especially thank our distinguished panelists once again for providing testimony. You can find our 9 policy recommendations that Lynn alluded to in our press kit, and that was sent to you if you registered, or you could also find it later today on the project website, and that's www.covid19farmworkerstudy.org. Once again, we'll post Sandra's testimony that we didn't get to hear today. We'll post our preliminary findings and recommendations for action. Someone asked if this is available in Spanish. So far, our preliminary findings are available in Spanish right now. They should be posted on our website. Our brief will be translated to Spanish as well, and we'll be adding that to our website as well. So stay tuned for that. Before we turn over to the Q&A panel, I do want to share the mic with our fiscal sponsors, CASA of Oregon. And so next, I'll have Rosie Andalon tell us a little bit, and share a little bit of their testimony. So go ahead, Rosie.
Good morning. My name is Rosie Andalon. My pronouns are she, her, hers, and I am the Real Estate, Housing, and Development Assistant Director for with CASA of Oregon. CASA of Oregon is a nonprofit organization that develops affordable housing and programs for farm workers and other low-income populations throughout the state of Oregon. We are acting as the fiscal sponsor for this project, and one of the key things I would like to stress out is that farm workers are essential workers. In addition to being drastically impacted by COVID-19, they have also been impacted by fires throughout the state. There is a need to continue gathering information and surveying in the Southern Oregon region of the farm workers that have been impacted by the fires in addition to COVID-19. Thanks, Jennifer.
Thank you, Rosie, so much. Yes, and just as a reminder, we still have a phase 2 of the study that we are hoping to carry out based on what we found today. So now I'm going to turn it over to our discussion panel, and that'll take the rest of our time together. And our team behind the scenes has ordered many of your questions. We probably won't get to all of them, but if we don't, we want to follow up and make sure that all of your questions are answered. Again, we want this document, these preliminary findings, to be public. We want you to have access to them so that could inform your responses as well. So for this Q&A discussion panel, we'll have Lynn Stevens again with us from the testimony. She'll join us again in the Q&A. We'll also have Ron Mize from Oregon State University. We're also going to have Ubaldo Hernandez from Comunidades, part of Columbia River Keepers, joining us, and then Reina Lopez from Pacun Farm Worker and Latinx Working Families United. So I'm going to choose a question here based on what my team is giving me. And one question we have is, there are well over 100,000 farm workers in Oregon, with over 5,000 just in Woodburn alone. Why did we only sample to 214 in this study? How many different employers are represented in the 214? So how about we give that question over to Ron Mize? Do you want to take that, Ron?
Sure, I'm happy to answer some of the technical questions about the survey, and I'll be really quick on this one. My name is Ron Mize. I'm a professor of language, culture, and society at Oregon State University, and currently the coordinator of the Ethnic Studies Department. So our survey is a sample. There's just like everything we know about farm workers is based on samples. So the numbers that we have about the 50,000 farm workers living in Woodburn, or whatever those numbers that were cited, recognize that came from a sample survey as well. The two places where that came from, either the National Agricultural Workers Survey, they survey about 4,200 to 9,300 farm workers every year. It varies based on their funding. Or if they collected the data from the American Community Survey, which is the US Census, there's only about 295,000 people in the entire United States that are surveyed to answer the questions about the ACS. There's about a 1 in 480 chance that you would actually participate in it. So we're basically using the same methodology that survey researchers have been using for decades, if not centuries, to try to use our sample to extrapolate of what the overall population characteristics are. It's important for us to identify that this is not a random sample. To do this rapid response survey in the way that we could do it in such a short period of time, we needed to use the existing networks of farm worker serving organizations who already had contacts with farm workers on the ground to be able to get answers to these questions quickly, the vital information we need to know about COVID's impact on Oregon's farm worker population. So our survey results are very good representations of farm workers who have come into contact with farm worker serving organizations. If anything, our results are probably underplaying the impacts because we're not reaching farm workers that are living in labor camps that are not connected to PICUN or CASA or Comunidades or UNETE or any of the other organizations. So if anything, I think we should look at our results as really in some ways the best case scenario, so that when half of our farm workers are not aware of the relief funds that are available to them, these are the folks that are actually connected to the organizations whose work is to make that available. So there's a lot of extra education and work that we need to do on our end to be able to get this information out to as many farm workers as possible. Thank you, Jenny.
Thank you so much, Ron, for that answer. So another question that we found in the chat asks, did the workers work in the 500 plus air quality because they have strong work ethic, or because they do not have a choice because no law is protecting them specifically? So how about we give this question over to Reina. Reina Lopez, do you want to take an answer? Do you want to answer this?
Hey, thank you. I think that there is a lot to say about this, but it can be said concisely. Mainly when we started hearing from workers on Tuesday for the wildfires, and also at the beginning of the pandemic in March, people just very concerned about what it means for them to go to work during a pandemic and during the wildfires. And again, one thing that has been repeatedly said in these testimonies and these reports is that people are going because they have to. I mean, I think that we know that our farm workers are essential. They were essential before, they'll be essential after the pandemic and after the wildfires clear up. But we also know that people have a lot of dignity, a lot of respect, and are very proud of their work. But also we know that people are making between $24,000 to $27,000 a year. And that's at the median and at the high end, right? And that a lot of the times losing one day, losing 2 days, or losing weeks of work is just not an option. People don't have paid leave. People don't have savings. A lot of times any little guardaditos that people have, it goes back to the familia back in Guatemala or Mexico. And losing a day of work is not an option. People have to go to work. And sometimes, a lot of the times actually, people are in this catch-22 where you go to work and you risk yourself and are literally risking your life to put food on the table for America and your own family. Or you stay home and it's a risk to your livelihood and making ends meet.
Thank you so much, Reina, for that answer. And yeah, I think you're absolutely right. So we have a question here to Valentin, or for Valentin, but I think Lynn can also support with this question here. Did Indigenous speakers lack information about COVID precautions and social distancing, or was it the information about relief funds or other assistance and support that was missing?
Thank you, Jennifer. I would like to just quickly add to what Reina talked about. I believe that our state does not have any regulations when it comes to working out in the fields, under heavy smoke. And so that's something that we need to be looking into. And just, the question that was just posed, I don't have the exact language of the survey question, but based on my experience, there's a need for more information about the prevention of COVID-19 in Indigenous languages. As I mentioned in my testimonial, there's 22 different Indigenous languages spoken here by our farm workers in Oregon. And so I think we need to expand the educational materials in other Indigenous languages as well. And I'll let Lynn to add more on this question.
Thank you, great question. It's both. People not getting information on their work site about masking, distance, hand washing in their own languages. and also not having information about basic worker rights, the quarantine fund, rent assistance, and other programs. They are supposed to have that information, but enforcement of giving that information in inappropriate languages is not happening. And for example, one person I interviewed worked in a blueberry field with 200 people, mostly mostly monolingual speakers. And he said he was sure that more than half of them did not understand the instructions because people, and when we surveyed people and asked them, what language do you speak at home? 20% reported a language that was not Spanish. So their world 24/7 at work, at home, at wherever they are, is in an indigenous language. Some people are bilingual, some people understand Spanish, but they don't understand highly technical Spanish or how to access something. So it's also about having navigators, folks who can guide people, because it's not just about language, it's about literacy. It's about having a computer, about having access to internet and all of those things. So it's complex, but I hope we can really map out and get better support for our indigenous farm workers and all indigenous speaking workers in our state, because it goes beyond farm workers. Thank you.
Thank you both. So we got a couple of questions about work safety and enforcement. Someone asked, where's OSHA? Where's Oregon OSHA? Complaints are surely being filed. Are they being investigated? Did the survey inquire if complaints were filed with OSHA in these situations? Did these instances result in an inspection or penalties? So I'll answer part of this question and I'll send it over for folks to answer. We did not specifically ask in the survey about complaints filed with OSHA, with Oregon OSHA. We did ask folks if they organized in their workplace, but that is the extent of our question. So how about I give this question over to Ubaldo Hernandez from Comunidades, and then Reina Lopez, if you also want to take a stab at that question. So the question again is, where is Oregon OSHA?
Thank you, Jennifer. Well, that's a really good question. One other thing is when we talk about OSHA regulations, they are really specific. They do specify some regulations that they have to be implemented at working places. But the problem with that is not just the specifications that they give, is the end of those specifications, only if it's possible. So you can give the exact rules that people have to follow at working places, but if at the end you put if it's needed, otherwise if the workplace requires something else, they can change it, that banish everything you put on that. And I have that from people that is working in packing houses, that they ask me what they can do to report those issues. And I always refer them to go to OSHA and report those. But the problem is that a lot of times they come to do inspections, and where they say, well, it's up to the owner or the manager to adopt those if it's needed. You know, and that's a big problem when you want to talk to people about reporting these issues, because there's a lot of frustration from people when they say, well, they're not doing it, but they come and check and they say, well, it was necessary at that time. And then they feel really powerless. And those are one of the things that we need to change, because the problem with these type of indications take away power from our community to advocate for their rights. When they say, well, why should I call? If they're gonna come back and they say, oh, well, that was necessary at that time, you know? And it's nothing for them to protect.
I just want to echo what Ubaldo said because I think it's spot on. I feel like the OSHA side of things has been really, really tough. And back in June, we were actually able to advocate with the Oregon Law Center and PECU and several other partners advocating for workers' rights for temporary rules for when COVID-19 hit for farm workers, specifically in field sanitation, housing, and in transportation, making requirements for social distancing, PPE being provided by the employer, disinfection after every single trip, and more toilets and hand washing stations ratio to workers. So it went from 1 to 15 to 1 to 10. And we've got a really mixed bag of reports. Some folks are saying that some places are doing a really good job of implementing. And then we're hearing a lot of folks also saying that they're not being implemented. And where I think that, and there's also a push now, because these temporary rules are going to be over in October, to actually do a more permanent, requirement around some rules that would go into there's a group meeting right now on infectious disease. So that's still getting figured out and figuring out what goes there. But I think that what Ubaldo's saying is really spot on. A lot of farm workers have really lost faith in their agency because when there is a complaint that's filed, what ends up happening is that the inspector comes and a lot of the times things are, you hear these stories of things getting staged. And then what happens is, worker goes on the record, they take that risk, and then retaliation happens and there's no protections for these workers, right? So now what we're seeing is less and less people want to file these complaints. You're hearing about these super bad actors, but no complaints, because the last time the worker made a complaint, they got a boot, right? So unfortunately, this is happening. What we would like to see is that, number one, these rules that are temporary right now actually go into the books more permanently. We really see this in a long-term vision where we can actually have infectious disease protocols so that we're not scrambling next time, right? The response was really slow and that wasn't okay. We also, what we would like to really see is enforcement actually get empowered, because we're seeing folks stepping up to become these whistleblowers, but there's no protections for them, and there's no real teeth that OSHA has to go and protect these workers, and they also have to announce when they're coming, which I think that that's also problematic, because then that gives people a lot of time to make it look right, when OSHA comes. But we would really like to see some protections for these whistleblowers, and would really like to see enforcement have really rethink what enforcement looks like, because what we're doing is not working. And unfortunately, the rates of retaliations are really high. By the time we get to hear from a lot of workers, they've already been fired, and that makes the case a lot harder when we're trying to hold employers or contract labor contractors accountable. It's very difficult.
Thank you very much, Reina, for that testimony. And that leaves us at 11:58. And so I just want to have answer one more question. Someone asked, will partners in the study be taking the policy recommendations to the legislature? And so any partners in the room, Ubaldo, Reina, Peter, Rosie, I'll open that floor to you to close us out.
I'll just say a couple things really quick. We're really excited to file a couple bills for the legislative session coming up. And one of them actually is a whistleblower policy. Last year we called it the Oregon Corporate Accountability Act. This year it's going to be a little bit different name. We really want to highlight the whistleblower policy side of things. But basically it's an approach to try to address some of these forced arbitration contracts that workers are signing away their rights to sue, and also empowering whistleblowers in the workplace to really kind of be deputized by places like OSHA, places like Bully, who right now don't actually have the funding or the bandwidth to be enforcing a lot of these issues, but really allowing the workers to step up and take that role, empower workers. And it's something that we've been dreaming of for a really long time, and hopefully we can make it happen next year. as well as continuing to raise awareness about the fact that farm workers in Oregon still do not have collective bargaining rights, despite the fact that we have, you know, PECU and the organization I represent and all of these amazing advocates here. We still haven't been able to get that. And it's important, it's an important right to have, because when workers try to organize, they have no protections, right? And this should be a very basic right for anybody in the workplace to be able to organize and advocate for themselves and the people they work with.
All right, everyone. So thank you so much to all of our panelists today. I know we have a really short time and we're out of time now. Again, really want to thank Reina, Ubalo, Lynn, Ron, and all of our folks giving testimony and our partners for joining us in the study. This is not the last of the study you'll hear. We definitely want to push that information out to all of you. So if you have any questions or any of your questions didn't get answered, we definitely want to give you that information. So get in touch with us, or we'll try to follow back. But with that, enjoy the rest of your day, and thank you for advocating and being there on the front lines for farm workers, and we hope to hear from you soon.
All right, before you take off, Peter did have a message. He said he wants to just reiterate that CASA will be advocating for protections and will be supporting our partners in their advocacy efforts for farm workers.
Thank you so much, Rosie. Bye-bye, everyone.